Welcome to our last sketch in our series covering vasoactive agents. First, we met Johnny Nitro, who showed us how nitrates use cyclic GMP to dilate veins. Afterwards, we watched as sumatriptan sumo wrestlers reenacted how activation of the serotonin receptor causes arterial constriction. For our last sketch, we're going to focus on activation of the prostaglandin receptor, an important mediator of smooth muscle contraction. The last time we encountered the prostaglandins, we were at the NSAID baseball diamond, where we illustrated how cyclooxygenase enzymes COX-1 and COX-2 convert arachidonic acid into prostaglandins that mediate the inflammation process. Well, head coach COX-1 and his assistant coach COX-2 are back. Don't get too excited though. In this sketch, they're going to stay in the background, because instead of augmenting the activity of the COX enzymes, we're going to take advantage of a few of their prostanoid products. Take a look at the display next to them. Yep, it's a recurring symbol for prostaglandins, the pro-slugger bat. Numerous prostaglandin subtypes are endogenously produced by COX synthesis pathways. In the back of this pro-slugger sporting goods store, however, we're going to illustrate a few important clinical scenarios when these prostaglandins can be administered pharmacologically, resulting in some major effects on the smooth muscle of vasculature, GI, and reproductive tracts. So while Coach Cox is predisposed at the front of the store, you know how he gets, always demanding 110%, even from random employees of the sporting goods department, let's turn our attention to a few kids getting a little out of hand with those pro-slugger prostaglandin bats. Over at the extreme sports section, we've highlighted the letter E because we're going to illustrate a few agents related to E prostaglandins. First up, alprostadil, also called PGE1. Let the dill in alprostadil remind you of this dill pickle themed board, and let this dill pickle themed board remind you of erectile dysfunction therapy. Why? Because alprostadil injections are a second-line treatment available for erectile dysfunction, alone or in combination with other agents. So just remember that it raises that dill pickle up in the air, kind of like that erect pro-slugger bat he's holding. The reason why it's so effective is because PGE1 is a vasodilator, exerting potent, smooth muscle relaxant effects. To highlight this, our alprostadil skateboarder is sporting a floppy, dilated red arterial hoodie. Because of this potent vasodilatory effect, alprostadil is also used to maintain the patency of the fetal ductus arteriosus. So we've made him knocking that air ductus open with his pro-slugger bat. You see, the fetal ductus arteriosus normally depends on COX-2-derived PGE2 to act locally on vasodilatory prostaglandin receptors. At birth, PGE2 levels decline, allowing the ductus arteriosus to close. In certain types of congenital heart disease, however, it's important to maintain the patency of the neonate's ductus arteriosus until corrective surgery. That's where PGE1 or alprostadil comes in. Like PGE2, PGE1 is a vasodilator and inhibitor of platelet aggregation, and can be administered by continuous infusion to keep that ductus open. Conversely, situations arise when there is unwanted delayed closure of the neonatal ductus arteriosus. That's when COX inhibitors or NSAIDs can be used to block all that COX-2-mediated PGE2 synthesis, promoting closure of the ductus. So we've brought in a store clerk here holding on to our recurring NSAID inflammation extinguisher, sealing off that ductus, of course. Pfft, stupid kids. Premature infants can develop respiratory distress due to the failure of ductus closure, and the NSAID indomethacin remains the first-line agent for speeding up this process. However, this same effect is the reason NSAIDs are usually not recommended during the third trimester of pregnancy, when the developing fetus is at risk for premature ductus closure. Misoprostol is a synthetic analog of PGE1. This agent will be represented by the kid in front missing the ball as he swings that prostaglandin pro-slugger. Think misoprostol, swing and a miss, so Prostol. Misoprostol and related PGE compounds have important effects on the GI tract. They're cytoprotective at low doses, promoting mucus secretion by the gastric mucosa, and at higher doses, they can even inhibit gastric acid secretion. So the misoprostol Pro Slugger sports our recurring gastric protective equipment. Misoprostol is orally active and is specifically indicated for prevention of NSAID-induced peptic ulcers. So we've made him knocking over our recurring NSAID fire extinguisher. Remember, NSAIDs can lead to non-selective COX-1 inhibition, reducing the normal endogenous synthesis of cytoprotective prostaglandins. Patients on long-term NSAID therapy, therefore, may benefit from the addition of a PPI or prostaglandin analog to their regimen. E-prostaglandins and their analogs, such as misoprostol, have potent oxytocic actions. In other words, they have the ability to facilitate normal labor or terminate pregnancy at any stage by promoting uterine contractions. Throughout this sketch, we will represent this increase in uterine smooth muscle tone with a uterus-shaped sports bag expelling its contents. For this reason, misoprostol is listed as a pregnancy Category X drug. Okay, misoprostol is not commonly used as a cytoprotective agent, likely because of its adverse effects, including abdominal discomfort and diarrhea. So, as the diarrhea seeps underneath the door of this neglected public restroom, just remember that misoprostol's use is limited due to its activation of the uterus and activation of the GI tract. Dinoprostone is a synthetic preparation of prostaglandin E2, or PGE2. This agent will be represented by this kid here who wears the Extreme Sports Dino helmet. Dinoprostone is approved for inducing abortion, or for ripening the cervix for induction of labor in patients at or near term. Dinoprostone stimulates contraction of the uterus throughout pregnancy, so again, we've sketched in our recurring uterus sports bag letting out its contents. Dinoprostone also directly affects the cervix, promoting softening, so keep in mind that prostaglandins are not only important for uterine contraction. Prostaglandins like dinoprostone can be applied locally to facilitate labor by ripening the cervix. Alright, so far the agents we've covered have all been related to the E-prostaglandins. Over in the footwear section, let's shift focus to the F-prostaglandin analogs. Carboprost is an analog of PGF2-alpha, embodied by the Pro Slugger over here, going crazy with the cardboard shoebox. Carboprost is also used in obstetrics to increase uterine tone, so again, we've sketched in a uterus sports bag losing its contents. This agent can be used to induce abortion and to control postpartum hemorrhage that is not responding to other management. In other words, it causes the uterus to contract and clamp down on that excessive bleeding. Latanoprost and travoprost, derivatives of PGF2-alpha, are represented by the Pro Slugger here, messing around with the footwear, specifically the LA Tan sandals and Pro Traveler boots. Latanoprost and travoprost are stable, long-acting prostaglandin agents that can be used during the management of glaucoma. See those eyeball-evoking sunglass cleaner kits? Well, during all the commotion, a few of them have tumbled to the floor, depicting latanoprost's ability to increase aqueous humor outflow, thereby reducing intraocular pressure. Outflow is the key here, not aqueous humor production. So, as an extra reminder, we've also made the cleaner flowing off of the glasses as he gets a little overly excited about the spray. The major ocular adverse effect is increased iris pigmentation, which is due to increased synthesis of melanin in the iris stroma. It's most frequently seen in green-brown eyes, so our latanoprost Pro Slugger dons some cool brown hyperpigmentation sunglasses. Alright, we're going to wrap up this sketch with a brief discussion of the agents used to treat pulmonary hypertension. There are 3 classes of drugs to highlight: prostacyclin agonists, endothelin receptor antagonists, and phosphodiesterase inhibitors. Each exerts direct vasodilatory effects on the pulmonary vasculature. Just think of these two pulmonary rackets wielded in self-defense by our frightened customer in front of the pitching machine. Those tense arterial strings depict the narrowed and fibrosed pulmonary arteries that can result from long-term pulmonary hypertension. We've illustrated a woman specifically because idiopathic pulmonary hypertension usually manifests as dyspnea and exercise intolerance in women aged 20 to 40. However, numerous other clinical syndromes can lead to the development of pulmonary hypertension, including heart failure, COPD, and thromboembolic disease. And primary treatment is directed at the underlying cause, rather than the pulmonary hypertension itself. However, for patients with persistent symptoms, advanced therapy involves the administration of direct pulmonary vasodilators. So just like that stray baseball snapping the strings of the racket, all we need to do is ease the tension. Our first agent, prostacyclin agonists. Recall from the NSAIDs in the outfield sketch that prostacyclin, or PGI2, is a potent vasodilator and platelet inhibitor, normally synthesized by COX-2 at the vascular endothelium. Again, it's symbolized by the procycler pitching machine. Let that big, red, dilated barrel remind you of potent vasodilation. Specific preparations of prostacyclin used in the treatment of pulmonary hypertension include epoprostenol and eloprost, depicted by the inept store clerk inadvertently turning the procycler from a safe ELO setting to the deadly and lawsuit-inciting E-Pro setting. Epoprostenol is usually the first-line agent for treatment, as it has been shown to improve symptoms, prolong survival, and delay the need for lung transplant. However, it must be delivered by continuous IV infusion, so other oral or inhaled treatments have been developed. The major adverse effects of these potent vasodilators include flushing, headache, and hypotension. Just another satisfied customer fainting from the absurdly competitive prices. Moving on to the phosphodiesterase inhibitors. The loading funnel labeled PHIL should remind you of that PHIL suffix common to the agents that inhibit phosphodiesterase isoform 5, or PDE5, including sildenafil and tadalafil. The funnel is big, red, and dilated to remind you of the potent vasodilation caused by these PDE5 inhibitors. These agents work to increase intracellular cyclic GMP by inhibiting its breakdown by phosphodiesterases. As depicted by the prudent public service announcement in the back, the words "don't foster disinterest" should remind you of inhibiting phosphodiesterase. And the grumpy employee who's had enough of the general lack of competence at pro slugger sports represents the increase in cyclic GMP. It's our recurring symbol, the GMP grump. Increased cyclic GMP causes dephosphorylation of myosin light chains and smooth muscle relaxation. The resultant vasodilatory effects may be useful in the management of pulmonary hypertension, though most people remember sildenafil's ability to treat erectile dysfunction. Just remember Babe Ruth holding up that erect and very non-impotent bat. Classic baseball moment. Our last class of agents are the endothelin inhibitors, such as Bosentan. These agents block the effects of endothelin, normally a potent vasoconstrictor that also stimulates endothelial proliferation. In this scene, Bosentan will be represented by Bossman Stan. You know, it looks like this isn't the first time our inept employee has caused severe hypotension in a few of the customers, so to remind you that we're blocking endothelins here, Bossman Stan has brought over his last paycheck. Looks like it's the end of the line, my friend. End of the line for endothelins, that is. Let's make Bossman Stan's shirt a little disheveled, a little dilated and baggy, just to emphasize that endothelin inhibitors cause vasodilation to decrease pulmonary arterial pressure. Also, it looks like he got over there in a hurry because that is one awkwardly extensive sweaty spot on his shirt. Strangely liver-shaped, actually. A fitting reminder that Bosentan is associated with fatal hepatotoxicity. Therefore, patients taking this drug must have monthly liver tests. And of course, don't forget that unconscious customer underneath the pitching machine. All those potent vasodilators can precipitate severe hypotension, so watch out. Alright, a brief recap. Alprostadil, the dill pickle skateboarder, vasodilates to treat erectile dysfunction and hold that ductus open. Swing in a misoprostol, cytoprotective, and contracts the uterus. Watch out for an activated GI tract as well. Dino helmet dinoprostone also contracts that uterus and ripens the cervix. Cardboard box carboprost contract that uterus and control postpartum hemorrhage. And to finish it off, pulmonary hypertension therapy. You've got prostacyclin analogs, PDE5 inhibitors, and Bosentan, Bosentan, the endothelin inhibitor. They all vasodilate, and they can all cause hypotension. She's going to be okay, right?